Assalamu alaikum. We'll start our today's session. We have patient named Miss Lisa, 25 years, came with complaint of weight loss. Are you ready? I will share the time and then you can start. Ready, Dr. Mahmoud? Okay, Dr. Mahmoud, ready? Dr. Awatif, please.
Yes, 1 minute again.
You want 2 more minutes?
1 minute. Yes, I can start.
Okay, time will start now. Dr. Awatif, please start with Dr. Mahmoud.
Yes, okay.
Hello,
Hello, doctor.
my name is Dr. Hussein, one of medical doctor in clinic today. I'm talking to Mrs. Lisa, 25 years old.
Yes, doctor, I am.
Mrs. Lisa, I would like to take information from you and examine you. Is that okay with you?
Yes, okay.
And during this meeting, if you have any question, don't hesitate to stop me. Okay?
Okay.
Mrs. Lisa, it came to my knowledge that you have suffering from weight loss. Could you tell me more about it?
Yes, doctor. Actually, I lost like 10 kilogram over 3 months.
Over?
Over 3 months.
Okay.
Yes, I am here to know what is the cause of this.
Okay. I'm so sorry for that, and thank you for sharing this information with me. Mrs. Lisa, this loss of weight gradually or rapidly?
Actually, it is rapid.
Also, what about your appetite?
My appetite is good. I'm eating well.
Your appetite is good?
I'm eating well. Yes, I have no any problems with eating.
Okay. Do you have a high body temperature?
No,
Lump or bump anywhere in your body?
no.
Okay. Do you have a weather preference?
Yes, doctor.
Which
Actually, I am more comfortable in the cold areas.
in cold air uncomfortable?
No, I am more comfortable in cold areas.
Oh, okay. Do you have a hand shaking,
Yes,
sweating?
yes,
Okay. Do you have a swelling in your in front your neck?
yes,
Do you have a racing of your heartbeat?
yes, doctor.
Chest pain?
Yes,
Difficult breathing?
no,
Lower limb swelling?
no,
Cough?
no,
Nosy chest?
no,
Do you have a headache?
no, doctor.
Flushing? You feel flush? Do you feel flush?
No, no,
Do you have tummy pain?
no,
Distension?
no.
Change in your bowel habits?
Yes, doctor.
Tell me more about it.
Actually, it is loose motion, doctor, since same duration.
Since when? Since
Mhm.
when?
Same
3
duration,
months?
doctor.
Okay.
Yes,
Okay. What's the nature of this loose motion?
it is watery.
Contain slim
No,
blood
no,
related to a specific type of food like pasta, pizza.
no, doctor, at all.
Increase it? No.
Mhm.
Okay. Do you, Mrs. Lisa, do you have any past medical history or surgical operation I should be aware of?
No, at all, doctor.
Okay. Show me your medication list.
I'm not taking any medication.
Okay. Herbal medicine,
No,
over-the-counter medicine,
no,
allergic to any medicine.
no.
Okay. Okay. I want to ask you a special question, if you don't mind. Are you married?
No, doctor.
Do you have any casual relationship? I'm so sorry for this question.
No,
Sharing needle,
no,
piercing,
no,
tattooing.
no,
Do you have any skin change, especially tanning or hyperpigmentation of skin?
no, doctor.
Hypopigmentation,
No,
acid come to your mouth.
no, doctor, at all.
Okay. What about your water work? Frequency,
No change.
amount, color,
No, no change.
froth urine, water work, sorry,
No,
puffiness around your eyes.
no.
What about your mood?
Your what?
Mood?
Um, actually, yes, I think I became more nervous than before.
I'm so sorry for that. Do you feel depressed?
No,
Okay. Also, I want to ask you private question again, if you don't mind. What about your period? Is it irregular?
Actually, I have no any change.
No change. Do you have a joint pain?
No,
Stiffness?
no,
Skin tightness?
no.
What's your job, Mrs. Lisa?
Actually, doctor, I am worker. I am a
What?
cleaner. I am a worker. I am a cleaner.
How much this condition affect your job?
Yes, it's affecting my job. I think I became more tired or something like this. And also, I have awareness of heartbeats also.
I'm so sorry for this. I will go to yes, occupational health workers or helping us regarding this issue. Okay?
Okay.
Do you smoke?
No,
Drink alcohol?
no.
Mrs. Lisa, do you
你
have,
为什么还没有
have
塞的时
any?
候一停就停到 AF 什么？
Do you have dizziness,
No,
weakness,
no,
altered sensation anywhere in your body?
no.
Okay. Do you have? Do you notice your eyes became pale or yellow or both?
No,
Do you have muscle pain?
no.
Good. Mrs. Lisa, let me to examine you if you don't mind.
Okay.
I will general look for the patient.
For what?
Also, patient thing, cachexia or what?
Yes, not dyslexic.
BMI.
BMI is low.
Okay. I want to look to the hand. Any sweating?
No, yes, yes, there is a sweating. Yes, positive.
Stretching the arm for the fine tremor present.
There is tremor.
Mrs. Lisa, I want to ask you more question, if you don't mind. Do you have any visual problem, double vision or?
Visual problem.
Yes.
Yes, doctor. Yes, yes.
Which type
I
of?
sometimes, actually, sometimes I feel I cannot see well. Sometimes
You can
I cannot see well. Sometimes.
see double. You can't to see at all. What?
Actually, it is not a clear image. Sometimes I felt not clear.
Not clear. Also, do you notice any or any person knows that your eyes bulged out?
Yes, yes. It was not like this before.
Okay. Do you have difficulty of swallowing?
No.
Okay. I will continue my examination. Also, I look for examine the eyes for lid
Yes, for what?
refraction and
Um,
ophthalmos.
all positive.
Okay. I will examine the cervical lymph nodes for lymphadenopathy.
Negative.
I would like to examine thyroid. I give a patient water and swallowing. There is a mass.
Yes, it's move with the swallowing.
Yes. After that, I will go behind the patient and palpate the lobe. firm or smooth,
Palpate.
tender?
Yes, it is
The
smooth,
thyroid.
not tender. Smooth, not tender.
Okay. Also, I will. There is any change in Balmer cases? There is hyperpigmentation.
No hyperpigmentation.
There is vitiligo in the skin.
Negative.
Give me the vitals.
All the vital normal, but the pulse is 100.
Bus rate 100.
Yes.
Okay. Blood pressure was a normal bilateral.
Yes.
Okay. Rhythm of the pulse, regular or irregular?
Irregular.
Irregular. Okay. I will examine the precordium apex in place.
In place.
There is any added sound or murmur?
Negative.
Yeah. Okay. There is a left parasternal heave,
Negative.
palpable P2,
Negative.
lower limb edema, beating edema.
Negative.
I will sculpture the chest, air entry,
Negative.
basal crackles or crepitation, lower zone of the.
Negative.
Okay. I will examine the abdomen, any superficial tenderness or organomegaly.
1 minute remaining.
Negative.
Okay. Mrs. Lisa, what's your concern?
What is my
I
problem?
highly appreciate.
And what about my eyes also?
Okay. I highly appreciate your concern, Mrs. Lisa. From what we talk about it, and after examining you most likely have a condition called Graves' disease. Graves' disease is a medical condition of a medical term of medical condition in which there is the disturbance in defensive system was supposed to normally attack the bugs, but in your situation attacks your glands in front of your neck called thyroid gland, and also attack the eyes, leading to symptoms that you have. What you need to do is to refer you to group of doctors from gland doctors and social workers and occupational health workers and eye doctors to give you proper plan of management. Also,
Okay, time is up. Time is up. Yeah. Continue this sentence, then we'll start examiner time.
okay. We'll run some blood test and scan for your neck, that gland in front of your neck, and also we'll do a camera for your eyes. Okay.
Okay, examiner time. Present your case.
Okay.
Yes.
Mrs. Lisa, 25 years old, present with loss of weight for 3 months. Also she has tremors and sweating of the hands, and also she has loose motion. On examination, also she has irregular pulse rate, 100 irregular, and also there is a positive leg lag and lid retraction and ophthalm. Also there is ophthalmos. Also there is thyroid goiter, smooth, not tender.
Okay. Okay. Can you tell me what is your differential for this case?
In these symptoms and signs, my top differential here is hyperthyroidism due to Graves' disease.
Okay. What else?
Second is celiac disease, but against that, the loose motion not aggravated by a specific food containing gluten like pasta and pizza. Also, I will put a few chromocytoma, but the blood pressure is normal and no headache and flushing. Flushing.
Okay. What is your workup for this patient?
What?
What is your workup for this patient?
Investigation?
Workup, yes.
Yes. Okay. I will do a baseline investigation in the form of full blood count, LFT, liver function test, renal function test, serum electrolytes, and inflammatory markers. Also, specific investigation for the hyperthyroid activity. I will do a thyroid function test. Also, I will do a autoantibody screening for Graves' disease, like antithyroglobulin antibodies.
Okay.
Also, I do I do a full autoimmune disease screen, to exclude celiac. Also, we need.
So you said that for thyroid function test and thyroid and Graves investigation.
Yes.
Any else for thyroid?
Yes. I will do a radioisotope scan. I suspect hot gland, gland will take the iodine. Also, I will do a ultrasound for thyroid. Also, I will do investigation looking for complication in the form of ECG for this palpitation and irregular pulse. Also, I will do echo. Okay. Also complication in the eye, slit lamps, and fundoscopy.
Okay. How you treat the patient?
Multidisciplinary team approach.
1 minute. Yes.
Yes. In the form of the endocrinologist, ophthalmologist, and cardiologist, and social workers, and occupational health workers. Also, the main management controlling first this hyperthyroid state will give anti-thyroid medication in the form of the carbimazole.
Another thing you want to add?
Also, there is radiation therapy, but contraindication here is this ocular symptoms. Radioiodine therapy.
Surgery?
Right now, no indication of surgery. There is no compressive symptoms for this gland.
Okay.
Your time is up.
Yes.
Yeah, actually, excellent, Dr. Ahmed. Perfect. I will comment after Dr. Awad. Yeah, very nice performance. Thank you.
Okay. أيوة فعلا مشيت في الأبرز ما شاء الله كويس. Okay. I will comment regarding your approach is good, but about the symptoms that positive with you, you did not ask about the onset. Maybe this symptoms is not related, or there is other underlying cause like this loose motion, diarrhea, and also this palpitation can be other cause. Yes. Also, while you are screened for while you are confirming for thyroid, you did not ask about diarrhea. You forget, and then after a while, you remember to ask about diarrhea. It is good to exclude this addison. It's one of the differentials that need to be excluded in this loose motion and weight loss. And regarding the this big yes. Yes. Okay. Regarding your questions, you are married. You can ask also if you are sexually active. It is more accurate. Mm, in the swelling, you got the swelling. You did not ask. You did not analyze this swelling to see if there is any affection, compressive symptoms. You did not ask clearly with the swelling. And yes, the pulse, you check the pulse, regular or irregular, is good. Also regarding the history, you checked for a gravis. You should also exclude the other causes of hyperthyroidism, like Hashimoto, if I got any viral infections, any tenderness or pain in this swelling in the front of my neck, uh, just to exclude the other differential that can be excluded in the history. Um, Regarding the examination, uh, I think yes, in the chest only you need to check if there is retrosternal extension only. Uh, I think after you check the thyroid, you can check the area, the abdomen all first, and then you can come back to other chest because you did auscultation for the chest. I don't know why you did this. And regarding the differential, yes, first differential can be gravis, and also if you check for other differential of hyperthyroidism, you may found other positive can go in and can change the orders of the differential. Fuchrocytoma, I think it is the second differential because there is a tremor and there is some similarities between it and hyperthyroidism more than celiac. And also fuchrocytoma can have area. Regarding investigation, yes, you complete the investigation. Good. Regarding the eye, I don't know why slit lamp. I think no need for slit lamp. Only fundoscopy for papillary edema. Yes. Regarding the treatment, yes, the symptomatic treatment after counseling and advises also, and like smoking, but the patient already not a smoker. Symptomatic treatment, anti-thyroid medication. You ask it about pregnancy, this is good. And also you can mention the surgery as a part of treatment, and you can then comment that, but there is in this patient there is no indication for it. You can comment like this. This all my comments. Thank you.
Thank you, Dr. Awatif. Slit lamp for this because this patient prone for this corneal ulcer as a complication of ophthalmos.
Okay.
Yes. Yeah. That's one of the complications, you're right. Thanks, Dr. Awatif, for your comment. Thanks, Dr. Mahmoud, for the performance. For me, I consider like a full mark for you. You did everything while sometimes you missed the point, but you're coming back to this point again in another time. However, you didn't miss. If you miss, you miss a few things, and it's not that much affecting your marks. This is for me. Okay, let's start from the beginning. The analysis, how many kilos over how many days, the progress, it was gradual, and yeah, you can add here only where you notice this weight loss. Is it all over your body, or but it's with the weight gain more, so it's not important question. Okay, let's go to the association. Directly you jump to the constitutional, which give you the clue, immediate clue for your case. How is the appetite? So if you find the appetite is lost, the diagnosis will be different totally. It will go with cancer or infection or something serious. Since the appetite is preserved, so you will think about something related to thyroid or diabetes or pheochromocytoma or malabsorption syndrome. This is for the appetite. So since you have the patient has good appetite, you think about thyroid or pheochromocytoma. You ask direct about the temperature, the lumps, and the you ask in between for the pallor of the eyes to for other constitutional, for example, anemia. Scene is very important here. The headache to roll out, pheochromocytoma, the mood. You did the weakness, the sensation, the vision. For the eye complication, you did it late, but you remember at the end. Anxious is very important to ask about if she is feeling anxious most of the time to roll out panic attack or still in the thyrotoxic crisis or pheochromocytoma. Patient will have an anxiety. Cardiovascular, you found racing and chest pain, very important in this patient. You didn't analyze, however, it's okay related to the gland effect. So you, I guess, Dr. Awat, if you give the weather preferences here wrong, you told him
No,
I
I
I feel
told him
cold
yes.
intolerance.
I told him I am comfortable in the cold.
Okay, okay. So yeah, comfortable in the cold. Yes, I thought it's intolerance to cold. Yeah. So it's
Yes.
yeah, it's the opposite. Intolerance to heatness, or I prefer the cold weather. Okay. So I wrote it wrong here. Okay, short of breath, cough, noisy breathing, and VGI, you ask for the distension, tummy pain, the bowel habit is very important, the loose motion. Then you analyze the loose motion. I like when you analyze it to roll out Addison or malabsorption. So is it related to diet, certain type of diet? Is it watery, any slime on it, any blood on it to roll out any also alarming for cancer? And you remember difficult swallowing later, which is important in this patient. You can add swallowing difficulty and difficult and the hoarseness of voice. This is for compression signs of thyroid. However, you remember it late, but at least you remember it. Yes, genitourinary, you analyze for the color and amount, frothiness, skin change, darkening. I like when you ask to roll out Addison as well, because the thinking of autosomal polyglandular syndrome, you can think about the joint, any muscle pain joint. Then the female history, you ask about the period. She told you there no change, but I guess it will be more scanty than usual. Okay, family history. I guess you didn't ask family history because I didn't click on it. So maybe you should ask about the family history. It could correlate with some, I mean, Hashimoto autoimmune diseases or autosomal autoimmune polyglandular syndrome. It will be also on the family history. The travel no need medical history as for the allergy, for the surgical, very important, and any long-lasting disease or any over-counter indication or any herbal. HIV, all the risk for HIV tattooing, sharing needles, sharing needles and piercing. You ask all this question. So you went very systematic, organized. This is the best system review ever. I heard and you practice with me. The patient examination, you did great. You start by the general look, underweight. Yes, she was. But I wished you start by the vitals. However, you remembered the vitals, blood pressure, pulse rate, and blood sugar you can ask. Then you start by the hand. It's okay. You can start by the hand for tremors. the sweating, and the darkening of creases, and directly go to the pulse. You ask her about the pulse, yes, but I prefer to do it by yourself for the tachycardia or an equal pulse. Immediately after the pulse, go to the pulse volume. It might be affected by a high cardiac output. It might be high pulse volume. You didn't do proximal myopathy. You didn't do also go miss. And in such case, it might be important. Then you mean to the eyes. You examine for slit lamp. But I prefer to start afro technique, A for acuity, because it might be affected here as you think about corneal opacity. So the patient might have affection of his visual. Corneal opacity, one of the common complication, the exophthalmos. Yeah, afro acuity, then the fields, then the reflexes, and you can do H shape. You didn't do H shape in this patient, and it's very important. You might have ophthalmoplasia due to the retrograde deposition of the proteins. The last thing, afro O for ophthalmoscope or fundoscopy. I guess it will not show anything here, or at least it will skip. Then the lid lag, still in the eye. Lid lag, exophthalmos also you can do by looking at the side of the patient. You will see the lower part of the cornea, the whitish area, it will be exposed. This for exophthalmos. And this is for the eye. Then you will go to the thyroid. This common case in exam, and it's rich of examination and information. So you did it great to collect all this data while taking history and to do examination. Go to the thyroid by standing. First, you ask the patient to swallow. Give him a sip of water to check for the movement of the thyroid. Protrude the tongue outside, to roll out thyroglossal cyst. Then you will palpate this by inspection. I mean this. Then the palpation. You stand behind the patient, compress from a side, then feel the other side. The other side in the next step, right and left. The tenderness and relation with the swallowing. Then the lymph nodes by palpation. Then percussion if you suspect any extension. Then auscultation of Berry you can do. The lymph node we did to rule out any cancer. Then you will go to the heart for examination. Quick exam for the heart. Murmur might be functional murmur due to hyperdynamic circulation. Detect the apex. Then go to the legs to examine for myxedema or any skin swelling or leg swelling. It might be also there as Graves' disease. I guess you did most of these things. So for me, it was perfect. Even you missed few things, which is not fatal. I consider it like that. The investigation and management, you will start by basic workup, as you mentioned. But for the thyroid, you should do total thyroid function test, T3, T4, TSH, and sorry, and you will do also the thyroid antibodies in the form of anti-TPO, thyroid peroxidase, anti-thyroglobulin. You mentioned only thyroglobulin antibodies, and yeah, that's it. For yeah, I remember also the infection in the history, very important, as Dr. Awatif said, to roll out post-infectious, which is called someone can Decorvan syndrome, yeah, Decorvan, to roll out it. One of the most post-infectious cause of thyroid. The Hashimoto itself, it will be in the autoimmune and the family history, you might. So this is for the investigation. Thyroid scan, you said, sorry, iodine uptake scan you did, and might need also if you suspect toxic nodule, but mostly it's diffuse uptake of the iodine, so no need for fine needle aspiration. The management, as you mentioned, antithyroid and antithyroid medication, and if there is compression sign, you can consider. If there is eye signs, you can consider referral urgent to the ophthalmology, and you might think about steroid. You didn't mention steroid. Dr. Awatif asked you what else, what else? I guess she was waiting for steroid for the eye signs and symptoms. Smoking must be stopped in this patient if there is positive family, if there is positive history of smoking. And we will go last but the least for differential. So our differential here, you can put two types of hyperthyroid, like Hashimoto or Graves. You can add also the other Decolvan in the active state or hyperthyroid state. Fucochromocytoma you can add. And for me, I can put diabetes, and you can ask also for the signs of diabetes, polytipsia, polyuria. I mean, in the history, do you feel thirsty? This is to rule out diabetes as autoimmune and as weight loss, because diabetic patient also, he has good appetite, but he's not gaining weight. He might lose weight. But it's okay for your differential, you give Graves, pheochromocytoma, and anxiety also can be there, anxiety disorder. But anxiety disorder, you will not lose weight. So let's give two differential of hyperthyroid state, Graves and Hashimoto. And you can put either diabetes or pheochromocytoma, or as you like. This is our case. Thank you, Dr. Awatif, Dr. Mahmoud. I like your performance, the systemic review today, very organized. Thank you. Any question or any comment? Is it clear? Okay. If no question, we can shift to the next scenario. Anyone want to add any comment? Any question? Dr. Mahmoud, are you there?
Yes.
Yeah, please give the scenario to Dr. Awatif if no question. Let's start the second scenario.
Mr.
I
John,
can write it here. Yeah, Mr. John, okay.
40 years old,
Mr. John, 45,
45 years,
okay.
complaining of fatigue for 3 months.
Dr. Awat, if you can see the scenario, 2 minutes, then we'll start.
Okay.
Okay.
I'm ready to start.
Okay, I will show the timer, then you can start. You can see the timer. Let's start.
Yes. Hello.
Hello.
I am Dr. Ahmed, senior house officer who is in the medical unit today. Can I confirm that you are Mr. John, 45 years old?
Yes, I am, doctor.
We are here to discuss some issues related to your medical condition. Is it okay with you?
Okay, doctor.
It is my knowledge that you have tiredness. Can you tell me more about this?
Yes, doctor. I suffered from this tiredness for 3 months.
So, yes,
All the time I feel fatigue or
I'm
tired.
really sorry for this. Okay, Mr. John, you said that this have tiredness since 3 months, all the day. Is it all the day same, or is it more at morning or at night?
Actually, doctor, so most of the day, but more severe at morning.
More severe at morning. Uh-huh.
Yes.
Besides this tiredness, you feel that you feel any dizziness,
No.
any change in your weight?
Yes, doctor. Actually, my weight is changed.
Since when you have this weight change?
Also, I feel that my weight is increased.
Since when?
Also, actually, this started 6 months ago or more.
And how your appetite?
My appetite normal as usual, as before. No change.
Normal. Okay. What is the site of this increased weight? Is it more at the center of your tummy, I mean, or it is more at the hands and feet, or it's all the body same?
Actually, this increase my weight, but I feel that more my neck.
In your neck?
Yes.
Okay. Besides this, do you have anyone told you that you are bullet?
No color.
Okay. You said that it's more in your neck. Okay. Do you have any is change in your skin? I mean, there is any bruises,
No bruises, doctor.
any stitch marks?
Yes, there is stretch mark.
Where is the site of this stitch mark?
Mainly around my tummy.
Around your tummy. Okay.
Yes.
Besides that, you have any back pain?
Yes, sometimes I feel that. You are right, doctor.
Any change in the shape of your face?
My face not as before, but I can't to tell you what exactly.
Any you feel that any hair in your face?
What?
Any hair? Yeah. Yes, it's Mr. John. Sorry. Okay. Beside this, yes, you have any snoring at night? Anyone told you that you are snoring at night?
Yes, my wife also told me like that.
You feel that you are sleepy during the day?
Yes, I feel asleep.
You have any headache at morning?
Yes, doctor, you are right.
Okay. And you said that you have this back pain also. You have any change in your bowel habit, loose motion or a hard motion?
Sometimes also my stool hard sometimes.
Hard motion. Okay.
Yes.
Okay. Regarding this back pain, is it associated with any stiffness?
Where's doctor?
This back pain.
In my back? No
Yes.
stiffness.
What is the side of this back pain exactly?
Maybe around the center of my back.
Any high blood pressure?
Actually, I did this. I checked my blood pressure sometimes. Also, my GB also notes that my blood pressure high.
Any medication you took for this?
No given me any medication, but put me in follow up to repeat the blood pressure.
Okay. Any high blood sugar?
Yes. Also, my GB notes that. Also, put me in follow up.
No medication.
No medication till now.
Okay. Beside this, you said that you have any headache at morning.
Yes.
Is it increasing with sneezing or bending forward
No.
or cough? Hello?
Yes,
Anything?
sometimes when I sneeze, this I notice that headache increased.
Yes, yes. Any change in facial appearance?
My what?
Any change in the facial appearance?
Yes, as I said to you before, also there is some change.
Okay. Do you feel that your shoes became tighter than before?
No.
Any change in the size of hands and feet?
Your voice, doctor. سامعني دكتور باسم?
Yeah, your voice clear, yes.
My voice also? Okay.
Yeah,
Okay.
your voice too.
Okay. Okay. Do you feel that I'm ready to ask? I'm sorry to ask you a private question. Do you feel that you have any milky discharge from your nipple?
In what, doctor, again?
Any milky discharge from your nipple?
No.
Do you have? I want to ask you other private question. Are you sexually active?
Yes.
Any problems in intimate relationship?
No.
Any Do you have any cough?
No.
Any breathing difficulty?
No.
Any pain in your chest?
No.
Any cough in above of blood?
No.
Any tummy pain?
No. Tummy pain.
Tummy swelling?
Yes, I know that my tummy is also changed.
You
Maybe
can
swell.
understand it.
Yes.
Okay. 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 Okay, Mr. John. Do you have any past medical illness I should be aware of?
No, doctor.
Any medication you are on?
No.
Any allergy to any medication?
No.
Any over-counter medicine?
No.
Any herbal medication you are on?
No.
Do you smoke?
No.
Do you take alcohol?
Yes.
How much you are taking per week?
Sometimes 14, sometimes 15 units
Okay.
per week.
How your mood? Do you have any change in your mood? I mean, do you have any stresses?
Also, my mood not okay because of this tiredness, doctor.
Since when you have this mood change?
Also, since this fatigue, I suffered from this fatigue 3 months ago.
Okay, you feel that your life is precious for you?
Yes, doctor, sure.
Good. Any problems in your vision?
Yes,
What the problems exactly?
when I see I'm driver, when I see I cannot see side of the road in the mirror, like
I'm really sorry for this. Any problems with the vision at night?
what?
Any problems in the vision at night?
No,
Okay. Do you have any redness in your eyes?
no,
Any foreign body sensation in your eyes?
no.
Okay. I need to. Actually, I want to advise you, Mr. John, to stop driving until we finish your assessment and figure out the cause of your problem. Because it is if you continue this will harm yourself, will be danger for you and the surrounding also. Is it okay?
Okay, doctor, thank you.
Okay. Do you have any joint pain?
Sometimes,
When the start of this joint pain?
also the mild pain in my knees. Sometimes,
Uh, in your knees? Any stiffness?
no.
Is it increasing with movement?
Yes, actually, that when I walk, I think this
Mhm.
pain increase little
Any
bit.
electric? Yes. Any electric like pain in your hand?
No,
Now you feel this pain till now in your knees?
yes, when I walk, doctors, but mild.
I can give you a painkiller if you need now.
Thank you, doctor.
Okay. Do you have any skin change or skin rash?
No skin rash, but only that stretch mark,
Uh-huh.
as I
Uh-huh.
said to you before.
Yes. Any awareness of heartbeat?
No,
Okay. Any chest pain?
no.
Any any loose motion, or you said that you have heart motion? Are you drinking a plenty amount of water?
What?
Are you drinking a plenty amount of water?
No,
Anyone told you that you are taller than before?
no.
Any muscle pain anywhere in your body?
Sometimes I feel that my shoulder is pain.
Mm-hmm. Mm-hmm.
Mm.
Do you feel that you are weak? You have weakness in your shoulder, you mean?
Little bit, so I can't lift the heavy objects
Okay.
as
I need to
before.
examine you. I need to examine you, Mr. John.
Sure, doctor, sure.
Okay, I will start by hand with the patient to see any skin change or skin bruising or stray mark in the arms.
In the
Any
arm,
body? Yes.
what do you
Stretch
want?
mark. Stretch marks.
Stretch mark?
Yes.
No.
Okay, I want to check the blood pressure if high or not.
Blood pressure high.
I can take bedside RBS for the patient. And also I
What?
want RBS.
RBS high.
And also I want to check the BMI for the patient.
Arm
BMI.
BMI increased high.
Okay. Yes. Then I will see the face to see if the rounded face. I will see if there is any patch of fat in supraclavicular or in the upper part of back. Is it positive or not?
Yes, positive.
Then I will check see the abdomen which is distended to its
Yes.
extent, and I will do um, I will do the examination for the vision for the patient. I will check the visual acuity, and also I will do H shape movement test.
Normal.
And yes, and also I
1
will
minute
take you
remaining.
visual fields also. Okay. Yes.
Visual
Okay,
field
Mr.
by
Yes.
temporal human view.
Yes. Okay, Mr. John, what is your concern?
What's wrong with me, doctor, actually?
Yes. Actually, most likely you have condition called the Cushing syndrome or Cushing disease, in which there is increase in the amount of protein called the cortisol, causing these symptoms that you have. Like also can cause this weight gain. And the cause of this most likely is a tumor in the master gland in your brain. And this is the cause of these vaginal problems that you have. So we need to do for you further test to confirm the diagnosis, and also we will refer you to a group of specialists to be under follow-up of them, including the gland doctor, group of specialists, including the gland doctor and also brain doctor, and specialized nurse. They will do the proper plan of management that you need. Any other concern?
Okay, time is up.
Thank you. Thank you.
Great, Dr. Awatif. You did well. Let's hear the examiner time first. Present your case.
Present your cases.
Yes. This patient is a 45 years old male, came with fatigue. Besides that, associated with came with fatigue since 3 months, associated with weight gain since 6 months, with normal appetite. He has features going with obstructive sleep apnea, in form of a headache in the morning, and also sleepiness during the day. He has snoring at night. Besides that, he has symptoms going with Cushing syndrome or Cushing uh, complication in form of back pain, and he has history of high blood pressure, history of high blood sugar, and electric-like pain in his hand, joint pain in his knee. Yes, that's all.
Okay. What's your differential diagnosis?
My differential, this Cushing disease, Cushing features most likely due to or secondary to pituitary adenoma.
صوتك يا دكتورة. Again.
This
Again.
Cushing, this actually this first differential is the Cushing disease secondary to tumor, pituitary tumor.
Okay. What else?
And also can be Cushing syndrome. Also, yes.
What else?
Also can be acromegaly, but again, is that no increase the size of limbs or hands and feet extremities, and no facial change, facial appearance change.
What else?
And yes, also can be hypothyroid, but again, I did not check for this.
Okay. How can manage this? Can you manage this patient? Management plan.
Yes, I will do a basic investigation in form of a complete blood count, renal function test, liver function test, renal function test, electrolyte, and inflammatory markers. And we will do also for the patient, we will do ABG also. We will do sleep test for OSTA, and also with the investigation for Cushing, 24-hour cortisol test, and also we will do a low dose dexamethasone suppression test. We will do a high dose dexamethasone suppression test also. We will do MRI for the brain and also ultrasound for abdomen. And also we can do X-ray for his knees, and we'll do a nerve conduction study for this probable or screen for carpal tunnel syndrome by nerve conduction study. Yes, that's all. Yes,
Okay.
and also we'll do imaging for the back also for possible osteoporosis.
Which type of image?
I will do MRI.
Yeah. Okay. How you can treatment?
First, I will consult the patient about this OSA and Cushing disease, and ask the patient, give the patient advices regarding the weight control, and we will treat this Cushing by treating the cause in this patient, most likely with pituitary cause. So we will do surgery for him. Multidisciplinary team include a gland, include the endocrinologist and neurologist and surgery in general, and neurosurgery Yes.
Okay.
Regarding the carpal tunnel, we will give the patient advices, and also we can give a splint and a painkiller also.
What type of electrolytes do you want to check it to see for it specifically?
I will check the sodium and potassium. I will
No, one single electrolyte.
potassium.
Okay. Thank
Okay, time is up. Please, your comment, Dr.
Yes,
Mahmoud.
Dr. Atif, thank you. She did well. Also cover all thing in the history. But my comment here, also in back pain, she didn't analyze the back pain, and also headache analysis for headache. Also, she missed it. Okay. In social history, when the patient also mentioned that drink alcohol 15 units per week, no advices. She didn't give him advice, especially in this case, pseudo Cushing, one of the differential. Also, regarding examination, she missed to examine for carpal tunnel syndrome. Also, she missed the cardiovascular for that palpable or loud P2, because this patient has OSA, one of complication, pulmonary hypertension. Okay. Regarding differential diagnosis, also this patient complaining of constipation. Also, she didn't analyze or ask for urinary symptoms for frothy urine, frequency, amount for polyuria, also puffiness around the eyes, to exclude this patient might could be multiple endocrine neoplasia. Okay, type 1, also parathyroid and this pituitary adenoma. Regarding differential, also yes, put here this constitution. If you did this analysis, you could be the main one. Also could be Cushing, pseudo Cushing, in view of this large amount of alcohol per week. Okay. Also regarding examination, also you can do hemoglobin A1C. Okay, and fundoscopy. This patient has high blood pressure and had blood sugar. Also, this effect of this adenoma also can affect the optic nerve.
Yes.
But also she took more times in analysis, because this in history this case is very long, a huge case, because there's many relations with other disease, OSA, and also this Cushing. Also need to search for this main. That is why the times for examination was short. This my comment here. Thank you, Dr. Awatif.
But I have comments regarding the headache because there's a lot of finding in the case. So I exclude only the I don't know if right or not, but I exclude only the red flag in the headache, and then I went through the case, and the back pain only I wanted to see if it is mechanical or not. Regarding the alcohol, you said that 15 to 16. I heard from one of the tutors that this it's not much to be to concentrate with alcohol 15 or something like this. Although it is more than 14. Yes. Uh, yes, that's all.
Yeah, okay. Great, actually, Dr. Awatif and Dr. Mahmoud. Both of you, as a performance today, is performance of exam, really. You did everything for both cases. Both cases are large and huge of information, as mentioned. I agree. Yeah, you missed some points only for perfection. I will tell you the comment, but you did
Yes.
great actually in your case, and Dr. Mahmoud as well. So let's start from the beginning. Uh, who someone will the case in the screen? Maybe okay. Let's start by the onset course duration, 3 months, and yeah, the analysis of the fatigue. When exactly? This is what we practiced maybe 2 days ago. The fatigue approach with the morning or timing. It will guide you to which case. So in this case, it was in the morning. So you think about OSA directly, and the distribution of weight gain. It will guide you to which diagnosis. For example, if hands, I like the question, what large in your body, what make being enlarged. So is it hands and feet, or is it body, or some areas in your body? So it was the tummy and the back and the neck as well. It will be also enlarged. So you think about directly about the Cushing or hypothyroid. When you ask about the gland, directly go to this preference, whether preference to roll out thyroid. So if rolled out, you have only Cushing, either Cushing syndrome or Cushing disease or pseudo Cushing. Let's start by system review. The headache, it was there. But before that, let's talk about the OSA. You ask about the snoring, the sleepy overday, the facial hair. You ask this question twice. So you repeated 3 questions, Dr. Awad. I wished if you will not repeat, or if you didn't repeat this question, it will give you some time. You repeat the question for facial hair, and you repeat another question I will mention later because I wrote here. Okay, the CNS, the headache, morning, yeah, analysis of the headache. That's enough to have the alarm sign. For me, it's enough. Maybe the site of the headache, okay, and the scale. You can add these 3 questions, but if you have signs alarming of increased intracranial pressure, so you have some important or some serious headache related to either spaceocular lesion or subarachnoid. So you will have it by your more analysis or by the case, like vision problem in this patient. So you have it from asking question about the vision, and he told you that I can't see the sides, and directly you advise him not to drive, but you didn't ask about the job. This is also one of important in this is occupational. You didn't ask about the job. It's very important. Yeah, the milk discharge. I like this question to roll out acromegaly immediately. You rolled out it, and as well for the hand size or shoe size. Okay. The constitutional symptoms increase the weight, the appetite was okay. Pallor, yeah, you repeat the pallor. Initially, you asked for the pallor, then you repeated the pallor again.
Yes.
So it's, yeah, repeated question. Take care of these. It will waste the time for the same question, which also might short your time in the examination. Let's go to the other system review. The chest, the cough, noisy way, chest. It's okay. You did it. Snoring, you can consider here in the case priority, but you asked it earlier. Cardiovascular system, chest pain, and awareness, you asked. The habit bowel, or the bowel habit, you asked. So he give you hard bowel motion. As Dr. Mahmoud said, you can think about something different. Why this patient having hard bowel motion? Is it hypercalcemia related to parathyroid and MIL, BIN1? Or maybe also some pancreatic cancer? But
Also
pancreatic
can be
cancer, yeah,
hypothyroid. Yes. Yeah, with this weight
yeah,
gain.
yes. Yeah, but for hypothyroid, he will mention the weather preferences.
Yes, I did not screen for it. Yes, I missed it.
You didn't ask endocrine, I guess? You asked. Yeah, you didn't ask.
Hypothyroid. Yes.
You don't write. Okay. The system also emits genitourinary. It's very important here to rule out diabetes as frothiness of the urine or polyuria if hypercalcemia. So please be systematic and you will never miss any system. The skin rash, you ask about the stretch mark. I like the question for stretch mark, the bruises, and he give you negative. Rash, you ask as well. The back pain for osteoporosis as a complication, you did it. And the face, yes, you asked for the facial rash, I told you twice. The sexual habit, you ask any affection. Yes, he told you no, I don't have, but better to ask about the periods. Okay, the family history, you didn't ask. The travel, always remember the family history in such cases. Men will be rolled out or rolled in by the family history. You didn't ask the family history, Dr. Water. Travel, it's okay, no need. Medical history, you ask for high blood sugar, high blood pressure, allergy, herbal, but surgery you missed. Okay, the HIV partner and sharing needles is not important in this patient. However, if you think about adrenalitis, could be if the patient is Addison, but he's not Addison. Okay, smoking, alcohol, very important alcohol here, as Dr. Mahmoud said. I agree with Dr. Mahmoud, very important than alcohol. It's either exaggerating or it will give you a diagnosis. Alcohol in
But
this patient either
but it
give you
is I
pseudo-Cushing.
think yes, I think it was 16. Even if 16, I will take serious and can be related to the case. Yes, I give him advice, but I don't think it will be related to the case if it is only 16.
Why? Why? Pseudo-Cushing is not related. Sometimes you diagnose Cushing as pseudo-Cushing because he will
Yes,
have the symptoms. So
yes,
it's
but
important. Why not important?
yes, it's important. But I mean, with 16 units, only 16 units can cause this sort of question.
The what?
Not
15 minutes?
16, 16 units per week.
Yes,
Only
why
two
not?
units more.
So what's the limited? What the limited?
The limit is 14. Yes, yes, it's 14.
So
But I think
even
yes,
14,
sorry.
if you have 14 and you have symptoms related to alcohol, you can ask him to moderate, and you can
Yes,
link with any extra dose of
yes,
alcohol.
yes.
It's not it's not a matter of units only. Maybe some patient is liable for related side effect of the alcohol different in different people. So
Yes,
don't just make it as a number and just correlate with the number. Okay.
yes.
The driving, very important. You did. Okay, let's go to the differential. You can give the three Cushing in this patient: Cushing syndrome, Cushing disease, and pseudo Cushing. Always put all together. You can put it, but you will rule out the Cushing syndrome by saying there is signs of Cushing disease. However, if the patient is known case of some disease and he's on steroid, you can put it. and you can't rule out the adrenal adenoma unless you will do CT, but you will not find pituitary adenoma. Okay, you can add, as Dr. Mahmoud said, min 1. Okay, it's very important still because he has also the features of hypercalcemia and might be also constipation related to pituitary cancer. Or,
Yes.
or if the patient has diarrhea, it can be like lipoma. But I guess gastrinoma can present it with constipation. Okay, this is for the differential. Let's go for examination. Because of short time, you didn't do full examination, and your patient is full of finding. Starting by the hand, you will do finger prick examination, blood sugar, and you will check for finger prick. You will check for the pallor anemia, I think the pulse. You will not, yeah, the pulse and the carpal tunnel is very important to ask if you have pain here. Then examine for carpal tunnel if he doesn't have. Then go to the paroxysmal myopathy. Then in the neck, the back, you can check for acanthosis nigricans. Then go to the face for the afro, acuity, and fields. It will be by temporal hemianopia. Then the reflexes, it will not be affected unless there is affection or compression or over the optic nerve. And fundoscopy, you can see also optic atrophy or papilledema if there is signs of compression on the optic nerve. Then this is for the eye. Then the face itself, there is also a lot of finding. The tongue, the size of the tongue, and the circumference of the neck you can measure for ossa, and you can open his mouth for the airway to check if it is swollen or something like that. Then the vitals also, yes, I mentioned the hypertension in the arm and the hand. Okay, let's go to the chest for, as Dr. Mahmoud said, for pulmonary hypertension signs. I guess you did that, Dr. Awad. You asked for examining the heart for pulmonary hypertension, loud B2, or maybe Dr. Mahmoud case. Okay, it's okay.
No,
This is
no, I didn't take it. Yes, but
you,
this
you
was his
didn't.
comment. Yes, no, I
You didn't
didn't.
have time. Okay. This is for the heart, for the also the infrascapular or interscapular fat distribution, and the bruises over the hand or over the skin, all over the body, and the stretch mark or stria. You can do the examination by crossing your hand over it. This is for the abdomen. Then the leg for any swelling in case of right side heart failure, leg edema. I think this is the examination properly for this patient. Yeah, let's go for the investigation as you started by general investigation, CBC, electrolyte, very important, hypernatremia, hypokalemia. It will be there. ABG, I like when you mention ABG. Always you are missing ABG, but you did it. But what you can see in the ABG, Dr. Awad?
I will see, yes, I will see metabolic alkalosis,
Excellent.
hypokalemic
Yeah,
metabolic alkalosis.
excellent. Yes, this is the point. You will have metabolic alkalosis. Okay. Then, apart from this, specific investigation for the case, which are free urinary cortisol level and serum cortisol level. You can then do low dose dexamethasone to detect the adrenal itself, or to do high dose dexamethasone to detect the pituitary, and CT, not CT, MRI pituitary to confirm the finding of Cushing disease or pituitary adenoma in the brain. Not MRI brain, Dr. Awad. You mentioned MRI brain. It's MRI pituitary.
Okay, good.
Okay.
Any need to do no need to do pituitary screening with this data or positive data I have from this case. No need to do a pituitary profile. Am I right?
Pituitary profile. No, it's clear for caching. It's caching.
Yes.
Okay. Then the complication, as you said, for polysomnography for OSA, and the X-ray for the knee for osteoarthritis. Yes, in the examination, you can do examining the knees for osteoarthritis by putting your finger or hand over the knee for the hotness, and you can also ask him to move. You will feel some grip over the movement. This is for the examination we list. X-ray the knees, and it will show also osteoarthritis features. And what for the complication? Yes, high blood sugar, hemoglobin A1C, and fundoscopy for the eye changes. Multidisciplinary team approach always start the management, ophthalmology, neurology, as you said, neurosurgery for possible surgery. And pharmacologically, didn't mention the pharmacological lines in this patient, which are methyropone, and ketoconazole. This is for Cushing disease management as pharmacological point of view. So our case done.
Please can you repeat the treatment?
Sorry, the what?
Yes, the treatment, the medical treatment.
Yeah, methyropone, and ketoconazole. This is suppressing the medication for the Cushing disease. By the way, echo also is very important for the core pulmonary and pulmonary hypertension. It's important to mention. Yeah, that's it.
Thank you.
Any other point or any advice about alcohol? Very important, Dr. Awatif, and driving. You can mention again to the examiner if you have time. I guess in this patient, every minute will be like for the presentation 1 minute, for the differential 1 minute, for the investigation 1 minute. So we have 3 minutes. The management plan 1 minute, or it might be 2 minutes. So I guess no time to be advising for driving. But still, you can you can advise while talking to the patient himself, or you can put it in the non-pharmacological side point or division. When you ask for the patient education counseling about the disease, you can ask him. I can tell him about driving and the alcohol intake. Any question or any comment? Thank you, Dr. Awatif and Dr. Mahmoud. Nice. Both cases are nice by performance and by the presentation. And yeah. No, Dr. Mahmoud, your sound is so far.
Yes. Also, for this pseudo pushing, also we can do insulin stress test to exclude it.
No, still your sound is not clear.
Now it's clear, my voice?
Yes. Much clear now, yes.
Regarding investigation, we can add also bedtime salivary gland cortisol. Okay.
Yeah.
Also, we can do insulin stress test to exclude pseudo Cushing. Regarding treatment of the OSA, CPAP, or intramandibular device or surgery. This regarding treatment.
Yeah. So you might guide the examiner to take you through any of these points. If you're smart enough, you can, if you remember this point, just mention it to the examiner, and he will tell you how you manage the OSA, how you manage, for example, if pseudo-Cushing, how you manage the complication of diabetes. Every point, if you are sure about your information, you can guide the examiner to them. But advice, don't take the examiner to point you don't know more about it. Like, for example, in this patient, if you are not sure about the pharmacological management of Cushing disease, don't tell me management plan pharmacological for Cushing disease. He will tell you, give me the names of medication. If, for example, Dr. Awatif asked me now the medication methyropone and ketoconazole. If you don't know, don't take him to this point. You are the one guiding him to the management. As Dr. Mahmoud said, you can guide him to the point of OSA. He will ask you. he will ask you how to manage OSA. You can tell him,
لا ما هي
yes,
ما
I will
ده
do
تيجي انت
whatever.
لا 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 ما هي موضوع
You
كده
can
مش شغل.
you can tell him, as Dr. Mahmoud said, the CPAP and surgery for maxillary surgery, and also I guess yeah, dietitian very important in this patient to reduce the weight and diabetes control. So be smart while answering. Don't take the examiner to the point you don't know more about. Thank you, Dr. Mahmoud, for the case and the advices. Any other comment from other colleague? Any question? Dr. Imaz, you wanted to add anything because you unmute yourself? You want to add anything related to both cases? Are you okay? Okay, let's go to the communication. Dr. Tanya and Dr. Sarah.
Yes, السلام عليكم.
Alaikum assalam wa rahmatullahi wa barakatuh. Yeah, Dr. Sarah, you prepare a case?
Please, Dr. Tanya, send me the case.
Yeah, I'm sending. Yes, already sent to the chat box.
Yeah, Dr. Sarah, you can read it loudly. I will try
Okay, I
to
will read it.
share it in the screen as well.
Okay. Mr. Ahmed, 65 years old, hypertension, diabetes, admitted 1 week ago with subdural hematoma secondary to full. Evacuation done smoothly and doing well. After that, discharge on good condition. على dexamethasone 4 milligram twice daily. 10 days after admission, with gum bleeding and fatigue. CBC showed low hemoglobin platelet 15. And on the further assessment, medical team discovered he given Methotrx instead of dexamethasone. You are doctor in hematology clinic. Sit with Mr. Adamson of Mr. Ahmed, explaining the current health status of his father and address his person. Okay. Okay, just a couple of minutes.
Yes, it's okay. We will give you 3 minutes. You're ready, Dr. Sarah.
Hello?
Yes.
Hello?
Yes, you can see the timer.
Hello?
Dr. Sarah, your voice is not clear.
Hello?
Yeah, we can hear you, but it's little muffled.
Hello?
I think she
Dr.
cannot
Sarah.
hear us.
Yeah, she can't hear us. Try again, Dr. Sarah.
Hello?
Yes, you can hear us now? Dr. Sarah, you can hear us? We can hear you.
Hello?
Use the speaker, Dr. Sarah. We can hear you, yes. Use your speaker or change the mic.
Hello? I can't hear you. Hello?
Yeah, we can hear you. You hear us now? Dr. Sarah, you can hear us. Dr. Sarah? Okay, we'll give her a chance to change the connection. Maybe there is connection problem.
Hello? Hello? Yes.
Yes, we can hear you now. Yes, clear.
Yes, I can hear you. Okay.
Yes,
It's a
okay. I will start
connection
the time. Yeah,
Okay.
yeah, it's okay.
Okay. Okay.
Here you are.
Okay. Hello, I'm Dr. Ghanem, Dr. Organic today. Are you Mr. Adam, son of Mr. Ahmed?
Yes, doctor. I am.
Hello. Hello, Mr. Adam. We are here to talk about the health condition of your father. Is it okay with you?
Yes, it's okay.
Okay, during our conversation, if you need to ask any question, please don't hesitate, okay?
Okay.
Now, can you tell me what do you know about your father's health condition?
Well, doctor, my father he was having diabetes and he was having high BP since many years. So before a few days, he suddenly fell down and he was admitted in our hospital. And that time, they did one kind of small operation in his head. And after that, he was well. They have given him some medication, but I don't know what happened. Now, just few days back, he was telling he's feeling so tired, and there was blood coming from his gum. So I don't know, doctor. I need to know what happened to him.
Okay, I appreciate your concern about your father's health. May I ask you what's your expectation about our meeting today?
Yes, doctor. I want to know what's the cause behind this, and maybe you will give some medication to stop that gum bleeding and everything, so that he could be normal again.
Okay, Mr. Adam. Um, I want to tell you, yes, your father was here because he has some bleeding in his head and done operation, and it was good and gone smoothly, and he was okay. But unfortunately, there is something happened. There was just like an error because we gave him drug called methotrexate instead of his original drug, which is dexamethasone. I'm so sorry for that.
What, doctor? I don't get it. You have given wrong medicine?
I'm so sorry. I'm so sorry to tell you that, but this is what happened. Yes, we gave him drug called Methotrx instead of his drug. I'm so sorry. I'm so sorry. That was not bad intention. This was wrongly happened. I'm so sorry for that.
So change the drug. It's okay.
Okay, this drug cause him his blood count to decrease because it cause like inhibition in his bone marrow. Do you know that?
I don't get it. So you are telling you have given some a wrong drug, and that is causing problem to my father? Are you going to
Yes,
tell that this causes him this type of problem? Now he's tired, and I
yes,
mean, all this happened
yes.
because of this.
Because this drug that cause him anemia, decrease in his hemoglobin, cause his tiredness, and also decrease the platelet count that cause him bleeding. I'm so sorry. I'm so sorry for that. Please accept our apologies.
How can you do that, doctor? You were first telling you have given a wrong drug, and now you are telling this drug you have given him a very dangerous drug, and that is causing him now blood from gum. How it can happen? How come you this much irresponsible your hospital?
Yes, Mr. Adam, I appreciate your feeling. This is very wrong, but I assure you that we have stopped this medication immediately. And we wrote an incident report and put this in his electronic file, and this will never happen again, and this will be discussed in our meeting tomorrow, and this will be investigated um, for to prevent this action from happening again. I'm so sorry. I'm so sorry,
Doctor,
Mr. Adam.
doctor, wait a minute. Wait a minute. I want to complain. It is so, I mean, irresponsible act from your hospital. He is an elderly man and you didn't take any care of him. How could it happen?
Yes, yes, Mr. Adam, I appreciate this. I understand your feeling. You have the right to complain, yes. But I assure you it was not bad intention. It's happened by mistake. I'm so sorry. I'm so sorry for that. Please accept
Yeah,
our sorry.
yeah, okay, but I want the name. I want the exact name of that person who did that.
Okay, Mr. Adam. I need to tell you that we work here like a team, and this is the fault of all the team and not someone personally. I'm so sorry for that. But you have the right to complain. This is your right, and I can advise you how to go to the patient liaison services to make your complaint. This is your right.
Okay, so I can complain, you are telling.
Yes, this is your right. But I assure you, this was not bad intention. We didn't mean to do this thing for your father, but I assure you that we stopped this medication and we change his plan of management, and we try to correct uh, this fault. And be sure that this will, if you complain, this will not affect his plan of management at all.
Okay, doctor. Okay. But this is really very much shocking news for me.
I'm so sorry. I'm so sorry. I understand your feeling, Mr. Adam. I know this is very hard for you and for your father, but we will correct this error, and we will help your father, and we are all here to help you and your father in this situation.
So what my father will going through now? What is your plan about my father?
Yes, well, now the first and important thing that we removed the wrong drug, and we will help him to overcome the side effects of this, and we will give him the right drug, and we will um, take care of his condition by a group of specialists to ensure that there will not any sequelae for this problem.
Are you going to admit him again? Does he need admission again?
For now, yes. Yes, we have to make sure that he is okay and his health condition is okay. So we will admit him and stop his drug and the wrong drug and give him the proper drug. Is it okay with you?
Okay, doctor.
Thank you, Mr. Adam. We are secondly, we are very sorry for what happened, and we are taking this issue seriously, and this problem will not happen again. And I assure you that your father will have our attention and have good care in our department. Okay.
Okay, doctor.
Okay, Mr. Adam. Have you any other concern?
How many days he has to be admitted, doctor?
I'm telling you that this depends about his condition and the opinion of his specialist. I assure you, he will be discharged when he is good and we are okay about his condition. Okay.
Okay. Okay. Got it.
Okay, Mr. Adam.
Won't you ask about some social, Dr. Osama?
In this situation,
Yes, why not ask him? Who's dependent on your father?
um,
Does he need any support? It's okay.
okay,
Okay,
what time is?
no problem, no problem.
Okay.
Thank you. Its time is up already. Thank you. Let's hear from Dr. Tanya. Then I will comment. But initially, before Dr. Tanya comment, I will say you're too much confident than any previous practice before.
Thank you.
Thank you.
Yes, it was very
Yeah,
nice.
Dr.
Very nice. It was great actually, because the thing just a little bit tiny things I felt, but what I always feel regarding communication, the way of approach actually differs from person to person. So it's okay in either way or any way. The main point, we should touch the every aspects that the concern and welfare, everything. So I don't feel that there should be any strict way, but still small things, whatever we are doing regularly, routine way, just to mention. That one is that when you tell me that there was medication, it was not at the first time, it was not clear. If you have got me, that I couldn't be angry because I didn't get you as a layman person, that you have given me Methotrx instead of dexamethasone. And as a layman, I don't have any idea what is Methotrx and what is dexamethasone. So how can I know that actually my father is having this bleeding actually because of this? So just to clarify him that at the first instant that yes, what he's having because of a wrong medication that mistakenly given from our side, that is named, that time you can mention like that, so that it will be a clear picture for the surrogate. Because to clear the picture, it needs 3 steps from your side. First, you told Methotrx was given instead of Dexa. Then I told very casually, why don't just change it? It's okay. You told no, actually, it was Methotrx that can have some low blood level. That time also you didn't clear that yes, it is happening. Why he's feeling tired and his blood count is low. So it took 3 steps to break down the news. So that's, I felt that to just to declare in one step. But it's okay. Again, I'm telling you, maybe your approach would be okay if the patient surrogate is so angry. So sometimes piece by piece, maybe. So this is number one. Otherwise, you apologize in a very well way. Just again, the word actually apologize. You said sorry so many times. Just apologize the word if you mention, that would be good. This is one thing only. And legal perspective, you just told about the incident report there. You didn't talk about root cause analysis or morning mortality meeting, or you didn't inform, you didn't tell that our consultant has informed, our staff has informed. So legally there are more steps than only the incident report. And medically you told actually, and I directed you because you were not telling me that for admission. So I directed you towards that, because you see the levels of the CBC is very low. So patient also should know what's the medical plan for him. So it would be a specialized team and we will admit him, and the way you told the treatment protocol, you told in a very well, but you just missed that you need to admit him. That is the thing, but I directed you towards there. Other than that, very nice, because dealing with angry patient is difficult, because mind is working to calm him down. So some points are not there in our mind. So whenever you are in hot state, it is very easier to, I mean, miss the point. I really know that, but you really did great. Thank you. Thank you, dear.
Yeah, I agree with Dr. Tanya and Dr. Sarah today, much better than the previous practice. She seemed to be more confident and more calm, not stressed as before. That's why she overcome this problem and she convinced the angry son. So let's comment from the beginning. Introduction was great, and the permission, just assume that you have permission from his father, and if he's the next of kin, you can do. If you don't, it's okay, but you can do it. What what he knows about the condition, yeah, he gives you the information, then you appreciate what he knows about his father and the expectation. You did all these steps, great. You then explained what happened to him. He was he was admitted before with subarachnoid hemorrhage, and he was prescribed some medication. And immediately, I wanted you to immediately mention the problem, as Dr. Tanya said. Yeah, he was mentioned medication called dexamethasone for the previous bleeding, and unfortunately, he was prescribed a wrong medication by our hospital. What, doctor? Are you serious? Yeah, sorry. I apologize on behalf of all the team. I admit there was a mistake. It was wrong prescribed, it was mistaken, and it was unintentional. Be sure that it was happened unintentional. We are not meaning to do that. It happened as a mistake. So again, I admit the mistake and apologize on behalf of the whole team in the hospital. It might be the pharmacy, it might be the doctor, the prescription itself, it might be any of all these teams. We don't know who exactly did this mistake, but you can say it was given by mistake or prescribed by mistake. Then, yeah, it harmed him in the form of low blood count, and there is what's called platelet, which is responsible for bleeding. That's why he has bleeding from his gums, and he feel dizzy due to low blood count. Okay, don't say anemia or anything else. Due to bone marrow, if you want to mention bone marrow, it's okay, but tell him what's the bone marrow. He doesn't know what the bone marrow. You can tell him, yeah, there is a deficiency or some suppression of the bone marrow, which is the factory of blood count or blood cells. And due to this sufficiency or suppression, insufficiency or suppression, the blood count getting low, and he has the manifestation of low blood count and low platelets in the form of what he presented with. Okay, and again, I apologize. So as doctor, don't say sorry, because this is clear and pure mistake. Yes, you are sorry, but apologize. Sorry, maybe you are feeling sorry for him, but apologize means that you are really apologize for the mistake happened by your team. Okay, again, I apologize. Be sure that we will do our best for your father care. And we did the immediate action. What was the immediate action, doctor? Yeah, we stopped the medication. Okay. What else, doctor? Yeah, we called the doctor for blood, the doctor or the specialist or the blood specialist to interact with this event. Why? He might need some antidote and he might need blood transfusion. According to your further need, we will update you by a meeting with the blood doctor or the blood specialist. This is for the action. Then what else happened? Yeah, we raised an incident report and we informed the root cause analysis to analyze more about this mistake and to know further what happened with this mistake, how it happened, and to reach to the bottom of this problem to prevent it from happening again to your father or any patient else in the hospital. Then our consultant knows about this mistake. We have a meeting called morbidity mortality, or we have a monthly meeting, or we have meeting with him to update about the analysis or the investigation. Then, yeah, if he asks to complain, I want to complain. Yes, this is your right. We can't prevent you. This is your right. Absolutely right to complain. I need a name. I'm so sorry. We are a team here. I can't give you a name. However, if you want to complain, I can guide you to the PULSE office, patient advice liaisons services, and you can file your complaint there. How many days he will be admitted to the hospital? I'm afraid to say that he might need some few days. Why, doctor? Up to weeks. Why? Because his blood count take time till be normal, and the blood doctor will assess the case. He might need blood transfusion or some blood products. Maybe he need platelets. Maybe he need antidote medication. Don't go through it more. This is not your task, but just a hint about this. Whenever your father stabilized and suitable to go home, we will let him go home. We should know we will know, or we should know that he's suitable to go home and safe to go home in this situation. And ask, you have 1 minute. You can ask who is dependent on your father. Does he need any support? Does he need any care at home? Because he has previous subarachnoid hemorrhage. You don't know what his ability at home. He's mobile or no? He can help himself or no? Or no? So offer some help for that. Does he smoke? Does he drink alcohol? Does he work anymore or he's retired? So we can support him even if he need at home for any support or kind of support you need at home. You did great, Dr. Sarah. What I wanted from you this scenario, you did the confidence. Always you were stressed, but this time you are not stressed. That's why you answered the questions comfortably and by a confident way, and you fluent. You didn't have time or take time to answer the concern. You answered it in the proper way and in the proper time. This is a great step for your performance, and please try to practice more and more to get more confident. Thanks, Dr. Tanya, for the scenario, and thank you, Dr. Sarah. Sorry for lengthy talking, but I want to make a
Thank you.
comment about the case. Yeah, thank you.
Okay.
Dr. Sarah, please write your case down, please,
Yes. It's okay.
in the chat
I will
box.
send it to the group.
It's okay. I can share it from there. Yeah, sure.
Okay.
Dr. Tanya, you can read the scenario. The scenario. on the screen?
Yes, I will. So you are a doctor in the world, Mrs. Smith, 55 years old, and has smoked for most of her life. She is widowed and lived alone, and she has recently become increasingly frail. She was admitted with a suspected chest infection, but has had a chest X-ray that is highly suggestive of a lung cancer in the peripheral lung field. Okay, now she is having cancer. She needs investigations to determine further management. You have been told by the nursing staff that her son has said that he doesn't want his mother to know about the diagnosis. He has also said that he doesn't want his mother to have any more investigations or treatment, but to be kept comfortable. Okay. Discuss and address the relative concern. So I'll sit with the
Okay,
relatives.
yeah. Take 2 minutes, then we'll start. Are you ready, Dr. Tanya?
Yes.
Okay, then we can start.
May I know the name of his son, her son?
You
Dr.
can say
Sarah?
Adam. You can say Adam.
Adam. Okay, sure. Okay. Hello there.
Hello.
This is Dr. Akhtar from Blood Clinic today. Am I talking with Mr. Adam, son of Mrs. Smith?
Yes, doctor.
So, Mr. Adam, we are here today to discuss about some issues related to health condition of your mother. Is it okay with you?
Yes.
Okay. So, are you next of kin of Mrs. Smith?
Yes.
So, before proceeding further, may I know, Mr. Adam, how much do you know about your mother's condition?
Yes, doctor. My mother was admitted to hospital because she has the chest problem. I thought it was pneumonia, but they told me that was lung cancer, and she was admitted and done a lot of blood tests and chest X-ray, and I'm not sure what's her condition now.
Okay, okay. So, Mr. Adam, do you have an expectation for our meeting today?
Um, I don't know, doctor. I want to know about her condition and how's she feeling now.
Okay, Mr. Adam, I'm sorry for your mother's suffering, and highly appreciate your concern. As you told that your mother was having some tiredness, and so she was suspected with some infection in her chest tube. That's why she came here, and we did some image of her chest. And the test result is with us. And I'm afraid, Mr. Adam, the result is not as we hope.
Okay, doctor. Yes, I know that she has lung cancer. I don't want her to know.
Okay, highly appreciate your concern, Mr. Smith, and I'm really sorry for the bad news bearer today. So, may I, do you have, before proceeding further to your concern about not knowing, not letting her know, or may I know, do you have good knowledge about this cancer of the chest tube?
All I know about this is it has no treatment.
Okay, so
Suffer.
would you please allow me to elaborate it a little bit more so that I can give you a
Okay.
clear picture of her condition? Yes.
Yes.
So, Mr. Adam, actually, your mother has, as you know, that already informed that yes, she's having lung cancer. This is abnormal cell division in the chest tube. That is leading to the symptoms that she's feeling that tired. Mr. Adam, if this condition is not treated, it could be spread to other organs. That is, we are calling in our medical term metastasis, and it can complicate it can be complicate the situation of your mother and endanger her life. Are you getting me, Mr. Adam?
Yes, doctor. That's why I don't want her to know.
Mr. Adam, may I know why don't you want her to know? Why you feel
Because
like you shouldn't know?
I don't want her to suffer. I want her to be comfortable, and this news will cause her much suffer, and she will be angry, and she will have a difficult time. I don't want her to pass through this.
I highly appreciate your concern, Mr. Adam. I can see how much you love your mother and how precious she is to you. Be sure that she is also as much precious to us also. Mr. Adam, she is now in totally competent, and she has the capacity. And don't you feel that she has her full right to know about her own condition, what is going with her, and also to take the decision of the treatment? And she needs actually further test to determine what kind of management she should have. It's not that there is no management. It is not like that. There is management in a form of chemotherapy, radiotherapy, some medication, but we need to know the staging first. Are you getting me, Mr. Adam?
I get you, doctor, but I think there's no use. Wouldn't be easy if we just let go, not not make her suffer more.
Okay, Mr. Adam, I highly appreciate your concern. It's a very valid concern. We actually, let me tell you that we are going to have a team that will contain a mood doctor and also along with our chest doctor. So we will not give her the information at a time. Maybe we will give him piece by piece and comfort her and let her understand the situation. Because if she doesn't go through the further test, so we will not know the staging and there will be delaying in the treatment, and ultimately you are endangering her life. Are you getting me, Mr. Adam?
Now, are you saying, doctor, that there may be treatment?
If we don't know in what stage of the cancer is that, we cannot be sure to tell about it. Okay, so if it is not that much advanced, yes, there is treatment. Even if it is advanced, we have some supportive treatment, but we need to sort it out first. Are you getting me, Mr. Adam?
I'm getting you. That, yeah, yes. You mean you are going to help her? You're going to ease this for her?
Yes, yes, we are going to have a proper management plan, and in every step of her suffering, we will be there with full support, with mental support, psychosocial support. There will be social worker, our all chest specialist, I mean our chest doctor, mood doctor to help her regarding her mood control. As you were telling, she could be angry. So we will also support that. And so in such a with a teamwork, we will be with her throughout her journey. Is that okay, madam?
Yes, that's okay. But I'm still worrying about her shock. Worrying about her getting the shock.
Yes, I can understand how stressful condition this is for you, but as we have discussed that we will not, we will let her absorb the this news chunk by chunk. Like we will sit with her and let her know, and let her comfort her to be known that there we are there for her. We are not letting him alone. Is that
Okay,
okay,
doctor.
Mr. Adam?
Okay.
Okay. Do you have any other
Maybe.
concern, Mr. Adam? Yes. Yes.
Okay, maybe this is the right thing. I don't know. Okay. Okay. No other concern.
Thank you, Mr. Adam. And may I ask you some other question, if you don't mind?
Yes.
Some personal question.
Yes. Yes,
Okay.
doctor.
So, Mr. Adam, from the notes, I came to know that your mother is living alone. So, is she well supported? Somebody else
She.
to take care of her
Yes. Yes. She is well supported.
is well supported. So, who is supporting her at home?
Me.
Okay. So, do you need any kind of social support?
No. No. This is okay.
Okay. And does your mother smoke?
Yes. Heavily.
Okay, so Mr. Adam, as you know, smoking is injurious to health, and in case of chest, this is very much injurious, and I would suggest your mother to stop that smoking, and if you want, we can also refer her to the smoking cessation clinic. Is that okay?
Yes. Okay.
Okay, so does your mother drink alcohol?
Socially.
Okay, so does she drive?
Now no. Was driving, but now no.
Okay, okay. So, Mr. Adam, I'm going to give you some brochures and some leaflets and website regarding this cancer of the chest tube that your mother is having, so that you can have more knowledge and about also the treatment protocol. And I will also direct you to some groups, those who are having this lung cancer, so that your mother could have in touch with other people who are having who are suffering from this kind of disease and coping up with normal life. Is that okay?
Okay, doctor. Thank you.
Okay, and I'm going to give you the number of our department also. If you have any worry or query, just feel free to call us. We are there always for help you and your mother.
Okay.
Thank you, Mr. Adam. Thank you.
Okay.
Okay, time is up. Yeah,
Okay.
Dr. Sarah, comment, please.
Okay, Dr. Tanya, you done well. Very well, actually. You show sympathy and empathy. This okay. You talk about lung cancer and treatment, and we don't know what type of cancer she has, and we have to do more investigation to know this. You also talk about her right to accept or refuse the investigation, and this is his right, her right to know. Also, you told me that she has to be joining in the decision making. This is her right, and you give a summary about the action plan and what we will going to do, and you trying to convince him that that's okay. Um, بس this all يعني. Thank you.
Okay, thank you, Dr. Sarah. Thank you.
Thank you.
Well done, Dr. Tanya. But I have question before commenting. Where is the word metastasis in the scenario. Does she have metastasis? I hear metastasis. I don't know from where. Is it written, Dr.
لا
Sarah, or
maybe لا not written هو no investigation done still only that is lung cancer in the peripheral lung field but no
so
investigation done.
uncertainty, cancer uncertainty, lung cancer
No.
uncertainty, right?
She is already known case of cancer, right? She needs investigation. I told her that she needs investigation to know that if it is spreaded or not for further
Yes.
management, because there is a line. She needs investigation to determine further management. So even the son was refusing that no test, no treatment. The son was refusing. So
what's
that's
written
why I
in the
mentioned.
scenario? Yeah, it's highly suggestive of lung cancer in the peripheral lung field, but no other origin from the outside the lung. It's from the lung.
No, because she was a smoker and no, nothing else
This is not suspective, suggestive, yani.
Yeah, I know it's suspected, but you mentioned metastasis. I don't know whether it's the primary to mention metastasis. This is my point. Anyway, let's comment, and I will comment on this point, okay, specifically. So what I wrote, yes, started good introduction. You ask for the next of kin to talk about the condition, what he knows, the expectation. Then you being sorry for her mother suffer, and the breaking bad news. And he's the one break bad news to you. He told you that he knows that she has cancer. According to the scenario, it's not written that maybe this is a hidden agenda by the son, that he knows that she has cancer. However, what he knows we should trust, and what he's saying we should trust. If he say it's cancer and we're already diagnosed, we will trust. But according to the scenario, no, it's cancer uncertainty. So I will be balanced between this and this. I will not tell him this is confirmed, and I will respect what he said. Again, I will tell him that this for his mother decision, it's what's called autonomy. Her mother or his mother should know and share and decide what she should do or what we will do with her. And she had the capacity, as mentioned by Dr. Tanya. It was great that she should know everything. The concern, I don't want my mother to know. Why? Because good question you ask why. Because he doesn't want her to be hurted by this news. However, we have our expert team. They know how to deliver the information to your mother without hurting her. Even we can involve the mood doctor who can concern about her mood after informing her this news. By any way, this is her right to know everything, and we will manage her after that according to her needs. Okay, sorry. The good thing also, we are here to sort out about the finding by doing the CT. There is possibility of management. So you give him some false hope in this sentence, but you corrected it while saying radio chemo, and you can mention as well the palliative therapy, because you might or she might need palliative management if it's advanced cancer and it will be difficult to be managed either by chemo or radio, or by chemo radio and as palliative management. Yeah, and we support her and we will be with her all this journey to take care of her after doing this investigation to know more about what ongoing and what the stages of hair cancer. Then you ask for the dependence. Yeah, as long as the patient uncertainty for the diagnosis, you can advise about not to smoke. Why? Because it might be related to the smoking. So you can ask here. But if it's terminal, we don't know. Till now, it's uncertainty. So we can say this is terminal or advanced or related or are related to the smoking. But still, you can advise her to stop smoking until we diagnose her. Still, also, she's not for palliative. Then alcohol, yes, good to advise. The driving here, I don't think it's wise. No need to mention about driving. Leaflet, brochure, website, and the most important point you missed, Dr. Tanya, the advanced directive and the lasting pathology. Because this patient maybe to be terminal and she might be in the next meeting or if the cancer extended to or spreading to the brain, it might be unconscious after this
Dr.
meeting.
Bassem, can I
Yes,
say
sure.
something?
Yeah, sure.
Okay. Okay. The case was all about autonomy. That the mother has the right to know everything about her condition as her mind is sound and he has a capacity. So she has to know this. The case was in Bastos. But I'm sorry, they never talk about social life in this situation. They only talk about the situation and trying to convince the son and like this, but they not extend to the social life. I'm not sure. Is it important to put it in each case?
No, you ask yourself this question. What do you think if the patient is terminal and or not terminal, need some support? Not only, we are not talking about any financial, we are talking about social support. Might she need someone to be with her, helping her, caring for her? It's not a matter of financial or something else.
Yes, I
So
know, I
for
know.
me,
If
yeah,
I was
yeah,
talking to the patient, but I'm talking to the son and convincing him with some idea,
yes,
um,
yes.
يعني
Why not
not
to if
related.
you have time, Dr. Sar, I agree, we will follow the pastis, but if you have time, still you have 2 minutes remaining. What you will do, you will summarize or you will ask this. It's okay to mention some support for the patient. You will be more safe for the examiner, and you will be, yeah, more, I mean, convincing to the examiner that you are caring for the patient. This is my opinion. You can follow or no, but fastest is not for Anne to follow. We can do that. For me, I will do as Dr. Sarah did. Sorry, as Dr. Tanya did. So the point is advanced directive and lasting power of attorney. Was it there?
No, no,
Even-
just
Yes,
about the autonomy of the patient.
Okay,
this is
so they
also
finished the
my
test.
question. She is not in
Yeah,
a terminal stage, no? So should we raise the issues of LPA and advanced directive?
I'm not sure as well because patient now, like an uncertainty of cancer. Maybe, yes, you're right. If not terminal, I don't know because Dr. Sarah said metastasis, I thought it's terminal. This is what I also thought. But if not written there in the scenario, I will not talk about it. But maybe this is the hidden agenda why Dr. Sarah raised. Is it, was it there, Dr. Sarah, or you just mention it by
No, nothing
some?
about metastasis. No, just to
I
do
hear this
tests.
point. Yeah, that's why I'm wondering why metastasis is mentioned by some of you, either you or Dr. Tani. I don't
Actually,
know
Because
I
from
mentioned,
it.
Dr. Basim, no, I mentioned like that if you don't go for the investigation, so maybe it will be late and it will be go
yes,
spread to
yes,
the
Dr.
other.
Tan.
That's how, yeah, that's how I
Ah,
explained. I
okay.
didn't tell
So you
that it
make
is
it.
already
Yeah,
metastasized.
yeah, yeah.
I
Okay,
told as a
okay.
complication.
Yes,
You made
that
it
was right.
as a
That
weapon.
was right.
Yeah, you made it as a weapon to convince her. Okay,
Yes,
okay.
yes, yes.
Yeah, I thought it's written. That's why I tried to read it the scenario again and to find the word. But if to make it as a weapon, yeah. That's why I accepted to talk about smoking because still maybe infection, maybe
Yeah,
nodules. It's still uncertainty. So if like that, no need for lasting power and advanced directive. I'm sorry to mention it, but what I understood by Dr. Sarah, there is metastasis and consider as malignancy. But if not, we will not ask it. Okay. So I apologize for this because I heard it wrong. Then I decided wrong as well. Uh, yeah, let's read the comment. I understand like complication, Dr. Hunaida. So maybe
Yes,
also someone else understand that there is metastasis, not only me. So this misunderstand make me decide for the last law of attorney and advance directive. However, if not there, no, don't ask. It's just uncertainty for the cancer, and it might be some infection, and might her father or his mother will be cured by antibiotics. Just only nodule in the lung, and it might be just simple thing. Yeah. So always talk as in uncertainty cases, be balanced between either cancer or something simple, but don't give false hope. Don't say, it's hopeless case. We don't know, might be something simple, and we are talking in advance in wrong or miss decision. Okay. I hope this is clear now for all. Thanks, Dr. Tanya, again. I'm
Excuse
sorry
me.
for misinterpretation. Yeah.
No, thank you. Always a
Okay.
small point hitting the brain.
Yes,
This is
always fix the information. Yes. Okay. Who's having questions? Someone? Yeah, Dr. Delia, sure.
Yeah, good evening, everyone. I
Hello,
want to
Helene.
discuss
Yes.
I want to discuss the case away from the scenario. Yeah, this patient is increasingly frail. His X-ray highly suspected for the cancer. So, what we could do as a medical team, just to investigate more, to do CT scan with contrast, yes, and to see if it's any high suspicious for malignancy. Then after that, because she's increasingly frail, so we need to do a MDT meeting to discuss what the proper plan for her, because she might not fit for even for bronchoscopy and for for biopsy. She might not be fit for that. So this is not my decision. It's need to be MDT meeting to discuss this and to discuss the patient performance, So is she fit for any any procedure, whatever the plan is. So we need to do step by step. First thing, to do further investigation, most probably CT scan with contrast. Yes. Then after that, we'll see if it's highly suggestive of malignancy. To confirm the kind of malignancy is to do a biopsy. This is normal thing. Yes. But in case of the patient is frail and increasingly frail, so if I know the kind of cancer, would that help? This is what kind of thing will be discussed in the MGT meeting. So, for example, if it's, for example, it's blah, blah, blah cancer. So what the option usually for the cancer? Either surgery, either chemotherapy or radiotherapy or chemoradio, yes? Or palliative. I guess this kind of patient wouldn't be fit for surgery, most probably wouldn't be fit for chemotherapy. Yes, are you agree with me? And maybe not fit for many kind of treatment for cancer, even for palliative chemo, palliative. So this is not the issue here. Just to understand what the case is. Okay, so this patient, we don't know yet, as Dr. Basim said, this is uncertainty, but highly suggestive. The probability here is very high. So probability high of cancer with the probability of can do nothing for her because she's frail and increasingly frail. So, and this is a step of how to investigate and to do a plan for the patient. But she's 55 years. I didn't know her age.
Yeah,
But
I revised the scenario again. She's Mrs.
there's something wrong
55.
in this scenario. There is something wrong. Okay,
I
so
agree.
isn't
I
match.
agree with you.
Everything is not match each other. So
Yeah,
and
frail and
patient
55,
is
I don't know.
55 and increasingly frail. What kind of frail? Why she is frail? What the past medical history of this
Yeah,
patient? There is something
I know.
missed. Okay. If the
I
patient is
agree with
frail,
you.
and I'm just reading it would be 85 or 95 years.
Maybe, yes.
Yes, because increasingly frail and very, yeah. So this kind of things I need to discuss it with, what kind of thing I need to discuss it with with her daughter. So from the start, I would like to say, how could I help you? Only because her daughter, she has concern. I'm not here amenable for discuss her diagnosis and everything. Discuss and address the relative concern. So here, my task is to talk with her daughter. Yes, that she wanted to discuss something with me, as is already. I got it from the nurse staff that she said that she like what is written here. Okay, so the main thing is to know what how could I help her? Yes. So if she said what is written here, so I need just to convince her about the autonomy. Okay, this is the main thing. I would be tested by the examiner. Okay, this is the main issue of this scenario, is to test me about the autonomy, because it's the autonomy of the patient to know her, as you said, Dr. Basim and Dr. Sarah and Dr. Tani, all of you agreed with that. This is the patient autonomy. So the mainly discussion, and then after that, to convince her by to give her to address her concern about what Dr. Basim said about that we are a very professional team. They know how to break down bad news, and just in case anything had happened, they could know how to treat it, how to deal with it. Okay, so this is the core of this scenario. Then after that, I will try to address. Okay, put in my mind that the plan is to do further investigation, and after the result, we'll discuss that in a multi-specialist meeting. So if she just asked me what the probability of, if she has just like probability of cancer, and then what the probability of management, or everything here is probability, nothing confirmed. So I will say this is an early to answer this question, because there is no investigation has been done for her to clarify that more. So yeah, as soon as we get that, we will update you about the result of the investigation, and about the result of the MDT meeting. I guess make it simple, and just put the main highlight. Think about that like it's in your clinic, in your ward, whatever. Just I'm not sure about this with just I deal with this patient like in the clinic or in the ward. I don't know what is mentioned in past test. I didn't see this watch this video or this, but I deal with this patient like in the ward, Is it
Yeah.
sensible or no? I'm not sure.
So the take-home message from Dr. Dalia, that we will deal with her still uncertainty, and will be simple, and don't give final decision for the management. Just refer to a team to sit with her, and to update you about the further investigation and further management. Is it like that, Dr. Dalia, right?
Yes, yes. So this isn't my decision to decide. I don't know anything about her. I can't, because in your mark sheet there is one point in your mark sheet that accurate information. From where you get the information that, for example, any information that in your mind. So it's highly suggestive, nothing confirmed. What's the next step? I will tell the surrogate about the next step, and we will take it from there. Whatever the result, we need to be this result. It needs to be discussed with multi-specialty team, then to come up with a plan. Okay, then after that the plan, we will discuss the plan with the patient, not with the patient, to
Yeah,
get her.
exactly.
Yes.
Yeah,
Then we will discuss the plan with the patient and see how she would like to be treated.
yeah.
Okay.
Okay, Dr. Dalia, this what was in the case, really, to convince the son and to talk about after his acceptance, to talk about the action plan, what we will do, and to tell her that she has a capacity and she has to take the decision by herself. That was the case. Nothing else.
Yeah,
Without
yeah, agree.
extending to talk about metastasis
Yes,
No, no, no.
advanced directive or something like that.
yes,
Yes,
I agree
yes.
with Dr.
We
Sarah
need
now.
to
Yes,
be very accurate about the information,
Mm,
not to
yes, and
add
to be,
any information
yeah,
from our, yeah, our
yes,
imagination. Okay.
mm,
So yeah, be accurate, be accurate, be accurate, because this is will be tested. There is mark on your mark sheet about be accurate and give a sensible plan of management. Okay. So this is you need to be. This is the steps of management. Okay. I don't know what plan is. It's not my decision. This is MDT meeting decision. Okay. So and even
yeah,
that the options of treatment will be shared with the patient, with your mom, or I don't know, it's mom, with your mom, and then we will come up of agreed plan of management with her and what suits her as a plan of management. Okay, so this is because this also to mention this sentence. There is also point mark in the mark sheet about this is to share the plan of management with the patient. So if you need to tick the boxes and to get the marks, you need to see what is what it's being asked from you to be done. Okay, so there is boxes for satisfactory, borderline, and unsatisfactory. To be satisfactory, check every point before thinking about how to solve the scenario.
yeah. I agree with you, Dr.
Okay.
Dalia, and Dr. Sarah now she clarified by the past. So,
Just one more thing. I want to
yeah,
say that
sure.
Dr. Tanya did all these steps. She convinced me. She did all these steps. She done well, right?
Yeah, now I agree for that. But apart from the word metastasis, which I misunderstood it, so yeah, she
Okay.
did it great. Yeah, but I misunderstood the scenario. But after hearing the words metastasis, that's why I start to talk about fasting more, but only and so on. However,
Okay.
still the smoking and the alcohol need to be touched as the cancer is not yet diagnosed or confirmed.
Okay. Okay.
Yes, thank you, Dr. Sarah, for this scenario. Actually, the debate and conflict make the scenario more clear and more fixed to us. I hope if we face such a scenario in exam, we'll do as a perfect way. Thanks all. Yeah.
Okay.
Thank you, Dr. Tanya. Thank you, Dr. Dalia, for your comment. Thanks, Dr. Hunaida as well. Thanks, Dr. Sarah, for the cases, and Dr. Tanya, thank you all for this day. If any question or any comment to be clarified, you can raise it now. Okay, we are going to weekend. Thank you, Dr. Hunaida. Have a nice weekend and happy weekend. We'll see you on Saturday. I will end the record, then we can nominate for Saturday participation.
I want a long clinical